Today, we are honored to welcome a true pioneer in the field of gynecological endoscopy, Dr. Osama Shawki. Dr. Shawki is known globally as a master of hysteroscopy. Dr. Shawki has trained countless gynecologists, transforming the way we diagnose and treat intrauterine condition. With the decades of experience, groundbreaking technique, and the deep passion for teaching, he is often referred to as magician in hysteroscopy. Beyond the operating room, his work continues to inspire professionals across the world. How are you, Dr. Shawki?
Speechless after your introduction. My tongue was tied with the lovely words.
You are amazing.
Thank you. Lovely to be with you today.
Yeah,
Thank
exactly.
you,
You're amazing, honestly. And the moment you just said that you're ready to come to my podcast, I was so excited. I cannot explain to you.
It's my pleasure. No, you speak very well, and you know how to get good things out of people. So you are talented in that.
Yeah,
Thank you for inviting me. Yeah.
So, Dr. Shawki, you have introduced so many people of the world, so many people to the world of hysteroscopy. But for our audience today, how would you describe in a simple terms, why was the technique become so essential in the modern gynecology?
You know, Dr. Bushra, that endoscopy, looking into body cavity by telescope, has revolutionized medicine. In the past, the diagnosis depends on crude ways like percussion, palpation, very, very primitive ways. And people can, what is inside? So when we entered the body cavities with light and telescopes, it was like you opened the cave of mysteries, okay? Like Alibaba cave, right?
Yeah.
So laparoscopy was the start, okay? And exploring the abdominal cavity was much easier to do because it's a big cavity. And when you distend it and you go by telescopes, you can identify the anatomy. One more thing, shifting from laparotomy to laparoscopy, the surgeon is looking into the same area where he used to play in. This is your playground. You did before hysterectomy. So you know where you are. You identify yourself. But that mysterious cavity where each and every one lived 9 months remained as a mystery, the uterine cavity. It was locked for a long time. Difficult to enter, difficult to access, difficult to identify. And any attempt start to look by telescopes is a potential cavity, it's collapsed. And the lining, there's mucus and blood and secretion. So it was very difficult to identify and diagnose. So that's why for a long decades, development of hysteroscopy was slow until suddenly when we developed and introduced different tools to expand the cavity well, to make visibility better, then gynecologists felt as if it's a new world. As I said, from laparotomy to laparoscopy, you're in the same world.
Yeah.
Nothing exciting about. That's why magician or jadugar, I love it. It's flattering. Yeah. But because they see something new.
Yeah.
And in this cavity, we could explore all the essence of start of life. Yeah. Humanity started here. Exactly. And I was being jealous from cardiologists because they think the heart is the ultimate organ. Come on. You need a heart to live.
Yeah.
You need the uterus to continue with humanity.
Exactly.
So I think the evolution in the distension medium and expanding the cavity allow doctors to see well, and definitely the technique and the miniature, decreasing the size of the telescopes allow that you can work into a small cavity.
Yeah.
So suddenly every gynecologist realized that this is our playground.
Exactly. And even for the patient, there's so much information. I remember my teachers, they used to do blind, talking here, talking there, the D&Cs. And suddenly this is so much information. People are involved. When he starts looking at the camera, everybody just involved. In the past, even the gynecologist wasn't involved. So since we are talking about the she's well, so when we counsel the women that you need a procedure, which is hysteroscopy. So the word procedure could be intimidating. So how do you reassure them that what we are doing with them?
Dr. Gul, I want to extend to my statement about development of hysteroscopy. Laparoscopy is a procedure for operating room.
Yeah.
Okay? But hysteroscopy is different. Hysteroscopy developed as an evolution extension of the standard Gynae office examination.
Yeah.
It became part of the essential part, not only to look inside the vagina, but to look to the cervix and to go more into the cavity and to see the inside of the cavity. Especially that the new instruments is a small size enough to insert it without pain.
Yeah.
So this was the revolution in office practice. And as you said, most of women health issues
Yeah.
come from the cavity: bleeding, infertility, postmenopause, polyps. So in the past, diagnosis for these issues was only restricted to imaging, ultrasound, which gives a black and white picture, but you don't see the tissues. So now with a very small telescope, Dr. Bush, I want to tell you something. One of the standard examination procedure in the office, gynae office, is to put a speculum and to do sounding of the uterine cavity to see how long it is. Okay.
Yeah.
The modern hysteroscopes, the diameter is less than the uterine sound.
Wow, amazing.
The uterine sound is 4 millimeter. The telescope of hysteroscope is 2.9.
2.9.
2.9. So now we can examine the woman without any pain, with extreme comfort. And we can open the cavity, put light, okay, and see the tissues. Seeing the tissues vivid is definitely different than ultrasound, black and white picture. And we can extend that more even to take a biopsy in the office. As you said, in the past, when there is something suspicious, we tell the woman, come tomorrow, take anesthesia, and you go blindly and you scrap, hoping that you touch the area which had the problem. I always say dilatation curettage is like you go into a room and you are blinded trying to catch a chicken.
Exactly.
It's right. How you
Or she running
how
around.
you running it. So when you do it under vision, I think D&C, which stands for dilatation and curettage, should stand now for deliberate crime.
That's amazing. So, because the layman people, the general public still think that D&C is happening. So that's a very amazing sentence to say that it should be called a deliberate crime.
Yes.
So let's educate our audience. What could be the reasons to do the hysteroscopy? Yeah.
Well, the indication is actually touches all subspecialties and most of the complaints of women health issues. Let's start by bleeding.
Yeah.
What does it mean, bleeding? Every woman has a uterus, which is a muscular organ. It's like a small orange, okay, lined by a velvet, thin, soft tissues, which is the endometrium.
Yeah.
And these velvet tissues every month slough off with some blood and cause menstruation.
Yeah.
Any disturbance or disease affecting this lining or the wall of the uterus might result in excessive menstrual bleeding or abnormal bleeding.
Yeah.
Like endometrial hyperplasia, increasing the activity of the cells of the endometrium, you call it hyperplasia, or presence of tumors like a fibroid or a polyp. So anything in the cavity, pathological, might lead to bleeding. And as you said in the past, doctors, to search for the code, they go blindly and try to catch any tissue. Now we go by the hysteroscope, we see the tissues, and actually by experience, visually, you can say this is normal endometrium, this is secretory, this is proliferative, this is hyperplasia, this is possible malignancy. So provision you have by inspection a diagnosis. Same like dermatologists doing now. So we improve the quality of diagnosis to more accuracy. And then we can introduce through channels in the hysteroscope small instruments. It's 2 millimeter. Okay, and we can catch a bit of the tissues and to send us for histopathology.
And that tissue also by seeing the most suspicious. In D&C, we used to take the blindly,
and
so we don't know.
You're not sure that you're touching the area.
Abnormal area or not.
Yes.
That's amazing. One of the Endo Dubai conference, you were talking about, you talked about that how sometimes we do unnecessary surgeries which could have been prevented through the hysteroscope. That was amazing lecture. So my patient would love to know what could be the places which could be actually they can avoid those surgeries by hysteroscopy.
Definitely, that the most commonly performed surgical procedure in gynecology is hysterectomy, okay?
Yeah.
And you'll be surprised to know that more than 500,000 hysterectomy done in the United States annually. And for a country like India, there are 2 million hysterectomy every year. So there is a huge, I think, abuse for applying this technique. And why women sometimes need hysterectomy? Because of bleeding. This is the or presence of a tumor. Okay. So tumors, mostly 95% of tumors affecting the uterus are benign, which is benign fibroid or presence of a polyp or something like this. So the easiest solution for a woman complaining of bleeding, let's remove the whole package. Let's remove the whole uterus.
Yeah.
All right. Whatever the cause of bleeding, whether a fibroid or a polyp or endometrial hyperplasia, the bleeding is not from the muscle of the uterus, it's from the lining. This is the lining. Okay?
Inner lining.
Yes.
Yeah.
The inner lining bleeds.
Yeah.
The fibroid is in the wall, but
Yeah.
it by itself is not bleeding.
Yeah.
It presses on the endometrium. And the fibroid is benign.
Yeah.
So the procedure that I introduce and I propose, instead of removing the whole coconut,
Yeah.
just remove the white lining of the coconut.
That's
and this
amazing.
can be easily done. We go by the hysteroscope through the vagina into the cavity of the uterus. We distend the cavity. We see now the lining. And by certain tools we call the loop, connected to electrocautery machine, something like laser, which cut and coagulate. And we shave the lining of the uterus. This is the source of
Amazing.
bleeding. Okay?
Yeah.
So doctor, what about my fibroid? Ignore it. You are now 40 plus, 42 years. Definitely this technique for women who completed their family and they don't want any further pregnancy, all right?
Yeah.
So when we remove the lining of the uterus, you go home after 2 hours. You still keep your femininity because women love their uterus.
Exactly.
It is a symbol. I am a woman because I have something different than my husband, okay?
Exactly, yeah.
So gynecologists, my dear Dr. Gul, please, you have to educate our colleagues that the uterus represents a symbol for the woman.
Exactly.
Okay, it's a symbol of femininity, so we have to respect her desire to keep it, yeah.
Exactly. We did some days back one podcast, think twice before saying yes to the uterus. And of course, like the Mirena and endometrial,
ablation,
ablation, resection, they are procedures. So a lot of people, the fertility also very close to the women.
Yeah.
And hysteroscopy has a role in the fertility. So let's talk about like how hysteroscopy can help in increasing the fertility.
Let me confess a secret, okay?
Yeah.
As a hysteroscopic surgeon, for a long time, I was feeling myself ignored by most of the Congress. They give us little time to give presentation. Okay.
But you're every conference.
Yeah. Until
Yeah.
came the assisted reproduction techniques.
Wow.
And you know that IVF and XZ, all these techniques are highly expensive.
Yeah.
Very expensive.
Yeah.
And unfortunately, it is the only procedure in medicine that the patient pays a lot of money and sign a consent that I accept success rate 30% or
Exactly,
40%.
yeah.
So many of IVF failure because problem inside the cavity, which was skip diagnosis because we don't have an accurate tool to check the lining. The cavity is where you put the seeds. So here they started to feel they need somebody to inspect, prepare the soil before we put this. So I started now to be popular. Every IVF center in India, they have my picture in there.
Wow.
Okay, that this we prepare the cavity before do the IVF.
Yeah.
So many problems in the cavity might lead to failure of pregnancy or failure of IVF procedure. Because congenital anomalies is one of the very, very common problems that they have, what you call it uterine septum. The cavity is bisected into two smaller compartments instead of one big compartment, and that leads to early termination of pregnancy, like abortion or preterm labor and infertility. And the correction of this anomaly in the past demanded that you cut the belly, you bisect the uterus, you remove this septum, and you take suture, a terrible procedure that might add more harm than a value. Now we can go by the telescope through the cervix and we see this view. Two compartments, and between this is the
just
septum.
like nose.
And we go by a knife, and in 2 minutes, you cut the septum.
And that is taken by the uterine wall.
Exactly. And
where it belongs.
We even, if it's a small septum, we can do it without even anesthesia in the office.
Amazing.
If it's a big septum with light anesthesia, in 15 minutes we can repair it. Many other pathologies like small polyp, submucous fibroid, some sticky adhesions, all these things affect the cavity and decrease the pregnancy rate and compromise the results of IVF. That's why we became very much demanded as a hysteroscopic surgeon. No IVF center can work without our
Even
support.
no conference can go on without hysteroscopy and Dr. Osama Shawki.
Thanks God that we have a place now. Good.
So one more thing, like when, like, is there a role, like some obstruction which is not organic in the tube, some debris can flush
Yeah.
Yeah.
Because initially people thought that hysteroscopy, that this tool or this technique only for the cavity of the uterus.
Yeah.
But fortunately, I found more extended value beyond that, just the cavity.
Yeah.
You know that the uterus is like my body, okay? And this is the fallopian tube.
Yeah.
And the male sperm, they travel through the cavity from a small opening here,
Yeah.
ostium, to the rendezvous site to meet the ovum and fertilization happen here.
Yeah.
So blockage of the tube is one of the factors of infertility.
Right.
There are many reasons for blockage, adhesions, obstruction, whatever, blah, blah, blah. But sometimes the cause of blockage is some debris or fine membrane at this small channel connecting the uterus to the tube. So when we go by the hysteroscope and distend the cap, flushing by the water.
High pressure.
Yes, this open the obstruction, open the
Yeah.
pipes. Same like when you flush your tub in the bathroom, so all the dirty
Flush.
debris goes and then it goes on.
Yeah.
So we found that many cases of infertility, they call it unexplained, they don't know why.
Yeah.
When they do just simple examination by hysteroscopy, they get pregnant after that.
Yeah.
Spontaneous.
Yeah.
And that's why they call it the lucky charm. The hysteroscopy brings good luck.
Yeah.
And I'm sure you know that happens the whole time when you send the patient for hysterography and then they get pregnant after hysterography.
Yeah.
It's because of flushing of the pipes. So
Yeah.
hysteroscopy can helps in clearing the obstruction, but
Yeah.
also there is another advantage. Some cases deliberately we want to block the tubes. Those who have hydrosalpinx.
Yeah.
When you have a obstructed femoral end and the tube is distended by fluid, this fluid regurges back into the cavity and
Affect the fluid.
affect the implantation. So in that case, we better get rid of the tube to separate it from the
Yeah.
uterus. The optimum or the best approach is to do laparoscopy and disconnection.
Yeah.
But sometimes these patients have extensive adhesion in the pelvis that the laparoscopic surgeon cannot reach the tube.
Yeah.
Or to reach it, he might injure the bowels. In that case, we go through the cervix, we see the ostium, and with a ball, roller ball, we cauterize the ostium.
Right.
So when we cauterize, contraction happen and block the ostium. So this is an alternative way to get rid of the hydrosalpinx.
And that is for before IVF, if
Definitely.
your tubes are abnormal with the water filled and
Yes.
they're distended.
Yeah.
Also, there's not the direct way of detecting tubal patency, but when you're doing hysteroscopy, you can detect that bubbles are
That's
going.
my test, yes. Shawki
Yeah,
test, yes.
exactly, yeah.
Yeah, I can create some bubbles,
Yeah.
okay? And these bubbles, they
They go
travel
in.
and they go from the opening. So
And
this
you
is
get to know.
a preliminary test
Yeah.
for tubal patency, and also it helps to flush the pipes. to
Exactly,
clear the
amazing.
pipes, yeah.
So now, because sometimes we advise hysteroscopy for the women who haven't had children yet. So if they are doing hysteroscopy, what's your take on that? Is it safe or not to have? Like people
Okay.
are scared sometimes.
Well, if our audience are non-professional medical,
They're general public, yeah.
I want to reassure them by saying simply, office hysteroscopy using a very small telescopes,
Yeah.
okay, without anesthesia, it's no more pain than insertion of a contraceptive device.
Yeah.
It is non-painful at all if you do it gently with a little flush of water and you go to look inside.
Right.
Hysterography, insertion of a contraceptive device, even more painful, right? But
Right.
the idea when the patient here, I will do endoscopic procedure, she
Yeah.
thinks that's something big. No.
Yeah.
Our telescope diameter is very small, even
Yeah.
smaller than the uterine sound, which the doctor uses routinely
Yeah.
in examination.
Yeah.
And the stension of the uterus, we use just a little pressure of water to separate the uterine wall, expand the cavity, and then we can look.
Yeah.
And we can take a biopsy, we can do some simple procedure in those. It's very tolerable,
Yeah.
but the doctor should have a very gentle maneuvering.
Yeah.
In laparoscopy, the patient anesthetized, so you can do this and that. You can
Exactly.
no, but in hysteroscopy, it should be very gentle movement. And I always teach when you start, the etiquette says ladies first.
Yeah.
So also water first. Don't go directly.
Yeah.
Stay inside the cell. Give a chance for the water to flush, open the way, and then
Without
you
pain.
gently go in.
Yeah.
It's very tolerable and no pain at all.
Yeah, that's nice. Yeah. Since we are talking about a general audience, which is of women, so what symptoms and signs would you want women to take seriously? What should tell women that they need to see, doctor need to see the inside the uterus? So let's talk about that.
Well, you know that now there are guidelines for women health issues, or like doing routine mammography after a certain age, definitely pap smear, okay? So what I suggest that every woman in the perimenopausal or postmenopausal should do routine ultrasound examination as a preliminary non-invasive investigation.
Yeah.
If the endometrial thickness exceeds certain limit, because I'm talking for non-professional, I will not say details. If the endometrial thickness exceeds certain limits, it's better we look by our eyes and take a biopsy.
Yeah.
Any woman has a persistent disturbance in the menstruation, she should have. Any postmenopausal bleeding, it is a must to do hysteroscopy and biopsy. Irregular bleeding in the childbearing age group could be taken lightly unless it is persistent. Then we have to look and take a biopsy. In infertility, there was a debate before, should we do routine hysteroscopy before IVF or not? The initial publication came that there is no value for hysteroscopy if the ultrasound is clear, there is nothing inside. However, lately, they realized that many of IVF failure are because of chronic endometritis. Up to 40% because of chronic endometritis. And chronic endometritis, you cannot, which is inflammation in the lining of the uterus. This you cannot diagnose by ultrasound. So there is an agreement now, agreement that hysteroscopy is a must. You have to look into the cavity in any case of failed trial of IVF. To do it as a routine before the first trial or not, this is still controversial.
Or it could be depending on the setup, because insurance covers most of the hysteroscopy, so rather going for IVF, women can also choose.
Definitely, and I was just coming back from the United States, and I heard surprising information for me about the cost of hysteroscopy. They told me that if you do it in the office, it's much less expensive than you do it in the operating room. So the government and the companies and the insurance are encouraging now to put office hysteroscopy as a standard and routine in clinics of infertility or general gynecology. And the cost is very minimal. The equipment is not expensive. The procedure is very low budget. And the value out of that is very high. We have a tool now to look inside the mysterious cave and to know why you have a problem, why you are bleeding, why you are not able to get pregnant, why when you get pregnant, you get abortion. So how can I ignore a possibility to look and fix? I love that. Look and fix it, okay?
That's amazing, So one thing, I think Dubai is more into the operation theater hysteroscopy, probably the pain tolerance and the luxury that might be different from the USA. So here probably the operation theater hysteroscopy is more common.
I heard that in UAE still the office hysteroscopy is not popular. I tell you why. Because the mistake is from the doctors, okay? What happened that if the patient feel pain, she will refuse that.
Of course.
Okay. So you bring me now to important pain management for office hysteroscopy. Number one, and the most important, is counseling. If the patient is prepared to what she will feel, she will accept it. But if you tell her, oh, no pain at all, and she starts to feel a little discomfort, you are lying to me, okay? She will not allow you to continue. So, and I call it verbal analgesia, okay? Prepare them, tell her that it is no more pain than insertion of a copper device. And if you feel little pain, it will be very short and temporary and much better than we expose you to general anesthesia. And one more thing, also the duration of the procedure. Office hysteroscopy should be for very short, limited time. That's why doctors should be trained how to do it gently, quickly, and get the results in short time. Don't waste time inside the cavity because the cavity is small. And also the insertion is very important. I always repeat it in my training courses, success is in the access. Means success to get the information and success that the patient will tolerate that. And my proof it is tolerable that in many countries in Europe and all over the world, it is done in the office routinely. All we need is to prepare the patient and train the doctors, and we will go into another phase of office practice.
And to bring the instrument for office hysteroscopy, the setup.
It's very low budget. Do you know, Dr. Gul, that the full setup of office hysteroscopy is less expensive than the probe of ultrasound?
Amazing.
Can you know that? Okay.
That's way too cheap.
And nowadays,
Maybe we didn't talk about it.
yeah,
in
yeah.
the past.
Nowadays there is many companies producing disposable hysteroscope. It's a
Amazing.
plastic,
Yeah, I saw that.
small piece.
Wow.
The expensive part in the procedure is the monitor and the camera.
Yeah.
Okay. So now the modern one, instead of having monitor, you can use your iPhone to
Wow.
click it on so you can get
That's
all the
amazing.
information and you can record and the
Wow.
patient data.
Even give it to patient,
Yes,
yeah.
yeah. And the telescope is very, very. It's a plastic, okay.
Yeah.
And it has a built-in camera, all right.
Yeah.
And you can connect it even to your computer.
Wow.
So you save the light source and the camera and the monitor. It's all in one.
Amazing.
And the cost, we're talking about $300.
Yeah.
About in dirhams is 1,000 dirhams.
I guess, yeah.
Something like this.
Yeah, something like it's not very expensive because probably going to the theater, anesthesia cost, everything increases. So probably hospital will be saving something also on the hysteroscopy.
If you occupy hospital bed, operating room, anesthesia, and anesthesia also has its own risk, okay? If you
Exactly.
save all that and the patient can go home immediately after office and
That's
go to work
amazing.
next day. So
Exactly.
all these are savings.
I think insurance will also love it and hospital will also be saving a lot.
You know, the AT&T company in United States is company for mobile phones, okay?
Yeah.
They did a study about the cost and the loss of sick leaves when the women go to do procedure like D&C.
Yeah.
It was tremendous loss.
Yeah.
So they calculated if the women do it as an office procedure, they
Yeah.
save a huge money. So we have to look at globally as
Yeah.
economically on the National Health Service on
And
the country.
also women returning to work. That
Yes.
would be amazing if just it's the same day thing.
I
yeah.
tell my patients, we'll do the procedure in the morning, you will cook the dinner for your children, and next
Amazing.
day you go to play tennis.
Yeah, exactly.
And this is true. This
yeah,
is
that's
true.
amazing because no anesthesia also, I mean, they can drive back to the
No
home
anesthesia,
also.
recovery is quick, and the pain is very
Amazing.
tolerable. Yeah.
Yeah. So now our listeners, I mean, they might have been offered some gynecology surgery. So when they should ask from their doctor that hysteroscopy is alternate options or safer option, on what surgery is being offered?
Listen, you talked about D&C.
Yeah.
So
or any surgery, maybe.
there should be no more D&C anymore. It should be
Yeah.
hysteroscopy and biopsy. Okay.
Yeah.
Well, for submucous, for fibroid, a very common tumor affect the uterus.
Yeah.
Okay, and when it is lying inside the cavity, it's a big challenge. How to remove it? It is like an orange inside a Coca-Cola bottle.
Yeah.
So the only available standard treatment is to open the belly, to break the Coca-Cola bottle,
Yeah.
to get this orange out, and then fix everything by suturing.
Right.
So instead of that, now we go from the cervix, from the mouth of the Coca-Cola bottle, and slice this tumor, this orange, into small pieces
Yeah.
and go out. So I think the alternative option by hysteroscopy should be the standard now. So it should
Yeah.
be for all submucous fibroid. Any perimenopausal woman suffering from bleeding, instead of losing the uterus or do advanced surgery like hysterectomy, whether laparoscopic or whatever, we just do shaving or removal of the lining of the uterus, and the bleeding will stop. And this is an excellent option for that.
Yeah.
So
even Mirena placement after hysteroscopy is one of the options.
removing of the lining endometrium, we call it ablation.
Yeah.
Okay, ablation. So there are several ablation technologies. The first generation ablation technology was the hysteroscope,
Yeah.
resection. The second generation ablation technology is the Mirena, which
Yeah.
is a small piece of plastic inside the uterus which release hormone. These hormones suppress the endometrium and the bleeding will stop. There are third generation ablation technology like the balloon and the microwave. This is other procedure. So we have now many options
Yeah.
to satisfy women and relieve their complaint without major surgery.
Yeah, that's amazing. So you have trained all over the world so many doctors to be the hysteroscopic. So what qualities you want to pass on to your students with it for hysteroscopy?
I want to raise awareness of every gynecologist that they should stop looking to hysteroscopy as its easy game.
Yeah.
And okay, I can do D&C. I already can dilate the uterus. Why not that I can go by the telescope?
Yeah.
I am good laparoscopic surgeon, so it will be easy to do hysteroscopy. Not at all. The skills needed for hysteroscopy and the technique is completely different than laparoscopy. I can give it example like the difference between cricket and golf.
Yeah.
Both have a bat and a ball, but
Yeah.
totally different techniques,
Yeah.
okay? So hysteroscopy requires gentleness,
Yeah.
require ability to work into a very small cavity.
Yeah.
In laparoscopy, we have 1, 2, 3, 4 instruments and a
Yeah.
cameraman, and uterine manipulator. In hysteroscopy, we don't have this leisure. You
Yeah.
have only one sheath, one instrument into a small cavity.
Yeah.
Training, I always say nothing is impossible.
Yeah.
Impossible means I am possible.
Right.
And everything looks difficult. It has a trick.
Right.
It has a trick. But don't underestimate the need for training.
Yeah.
Hysteroscopy is more fine, more delicate, more elegant. In laparoscopy and open surgery, you use the movement of your shoulder, your elbow, your hand. Hysteroscopy, it is only from the wrist and tips of fingers.
Yeah.
Until you train your muscle and your neuromuscular coordination to move from the laparoscopic mode to hysteroscopic mode, this will take time.
Yeah.
And I think my success all over the world that I could guide the doctors and help them how to use the fine movement from the wrist and hands and to go gently into the cavity and to move easily inside this small space. And the skills of hysteroscopy, I can look at as the skills of learning how to drive a bicycle. Okay,
Wow.
when you start first time on a bicycle, you will lose balance.
Yeah.
Okay, after some time, you drive very easily and even without your hands
Yeah.
on. So it needs time, but once you learn it, it will
Yeah.
stay in your hand.
Yeah.
You'll never forget it.
Actually, I've seen your hysteroscopy in the conferences. The economy of the movement, like whatever the movement, it's useful. It's not like, like something is moving and we are not gaining. With every move, you gain something. That's really
Exactly.
amazing.
Exactly.
Yeah?
Yeah.
So you're not just known for your skills, but you're also known for transforming that how the hysteroscopy is practiced. So what is the innovation or technique you're most proud of?
Well, Dr. Gul, that for every endoscopic technique, there are standards and guidelines.
Yeah.
For example, like for laparoscopy, we have to distend the abdomen with gas.
Exactly.
Okay, and then we can go by our instruments to work safely.
Yeah.
So for laparoscopy, it was accepted and agreed by everybody that the pressure of the gas should be like 14 to 15.
Yes.
Okay. For hysteroscopy, it was not clear. We use in hysteroscopy fluid. We distend the cavity by fluid, and then we start to operate inside.
Yeah.
The preliminary concept that we should use a machine to push fluid
Yeah.
with a pressure not more than certain level.
Yeah.
And they put that level should not exceed 100.
Yeah.
Based on some assumption in the mind of the doctors, okay? And when I started to do hysteroscopy, following these guidelines, I found that it was not enough to distend the cavity to see
Yeah.
well. Plus, the blood pressure
Yeah.
inside the pipes of the vessel is 120 over 80.
Okay.
Okay.
Yeah.
So if you are inside the cavity of the uterus and you see a tumor like a fibroid and you start to cut
Yeah.
the pipes open.
Yeah.
So if the pressure inside the cavity is less than the pressure inside the vessels, blood will trickle into the cavity. Little blood with the fluid, everything is red. You cannot see well.
Right.
So my concept that we have to change all the guidelines and all the design of the machines
Yeah.
to allow higher pressure.
Yeah.
This higher pressure should be higher than the vascular pressure to tamponate the vessels and allow good visibility, and then you can work inside the cavity. So this is my ultimate pride that I could change the concept. But Dr. Gul, you are in our field, and maybe you witnessed how much resistance I faced,
Yeah.
how much criticism I felt myself like Galileo.
Yeah.
Galileo was trying to put a scientific concept and it was rejected by all the big authority.
Yeah.
But since 2017, all the guidelines have changed now.
Amazing.
And all the design of instrument changed to a better setting that allows surgeon to do surgery safely in clear, good vision.
Yeah.
So this is actually what the revolution in hysteroscopy.
Yeah.
And I'm very proud when Dr. Jadip Malhotra from India introduced me in one session. She said, I look at hysteroscopy like before Osama and after Osama. Before we
That's
were not
amazing.
able to see well, to operate, but now it became very safe and very clear to us.
This is the reason we call you magician of
thank you.
hysteroscopy. Yeah.
Thank you.
So now women watching, they would want to know when they are getting hysteroscopy done by some doctor, how they have to make sure that they are in the safe hands, what they should look when they're about to go to hysteroscopy.
Well, it's not only about hysteroscopy. When the patient visits a doctor, right?
Yeah.
Still, there is some doubts inside her.
Exactly.
Will he do it properly for me or not? Okay. When I was in the United States, we used that the patient has access to all doctor profiles. She knows all his skills and procedures. Hysteroscopy now as a diagnostic tool and for minor surgery, I can say that every gynecologist can do it very well and very competently. Okay, there are certain procedures like the big myoma, and the big septum and the Asherman. This requires a higher level.
Yeah.
Fortunately, that all endoscopic procedures could be recorded on video format. All right.
Yeah.
So the patient will have a proof within her hand if she wants to do second opinion. What has been done inside her uterus, and was it done properly or not? And no gynecologist will take the risk to do something which put him in a trouble. Okay. Yeah. All of us now as doctors, we advertise ourselves by a decent way. We show our work, okay, in congresses, in meetings, and on media.
Yeah.
So my videos, my operation already in media, my colleagues are there. Patient can search, who is doing what and who is doing better, and then she can visit. She can choose. So it's easier now to choose your...
Especially this era, you can find a lot of... Everybody's social, people are there. Yeah. I've seen your channel, amazing, yeah.
Thank you.
So I would want to tell our women, our audience, like the most common myth you want to talk about hysteroscopy.
The most common?
Myth or misconception.
Misconception.
Like in the general public.
Yeah. Oh, well, the most common rumored misconception that it is a painful procedure.
Yeah.
And cannot be done without anesthesia.
Yeah.
This is absolutely wrong.
Yeah.
If you use the proper tool, the small diameter telescope, in the hands of the expert, it is very smooth, very simple procedure. The pain is very tolerable. If there is pain, even tolerable. I put many videos for myself operating and the patient talking with me, or the patient talking on the mobile with her friends, or playing on the Facebook, and we are doing the procedure. Okay, this is the real proof.
Yeah.
And when I always say, if you want to convince me that you can drive a bullet in field or Harley Davidson, show me. Don't tell me by your mouth. Yeah. So we have the proof that it is a tolerable procedure.
Yeah.
Okay. The other myth, which is, I say it's a debate now between us as a hysteroscopic surgeon and assisted reproduction colleagues.
Yeah.
They believe that they don't need us very much because they have ultrasound. We have ultrasound and it can show everything, right?
Yeah.
I do believe time and clinical studies showed that hysteroscopy and inspection of the cavity before the IVF can improve the pregnancy rate, can increase the implantation rate. And that's why I'm coming now to you for Dubai, okay?
Amazing.
I used to come to Dubai to give lecture. Now I had a contract with a very elite IVF center.
Amazing.
They do thousands of cases.
Wow.
They send me, Dr. Shawki, we need you to prepare the cavity before we put the seeds. So I visit many countries now, IVF center, to help them together.
Yeah.
We can reach a higher success rate and make more women happy and achieve their dream to have a baby. There is a say that health is a crown on the head of healthy people.
Yeah.
Only seen by the sick.
Yeah.
All right. I can add also that maternity and having a baby is a great blessing.
Exactly.
And those who are deprived from it, they live a miserable life.
Exactly.
And one more thing, infertility is not a disease. It is a social problem.
Yeah.
If some person suffer from appendicitis and he's the only one suffering,
Yeah.
All right. But if a lady suffering from infertility, the lady, her mother, mother-in-law, the whole family is suffering for
Suffers,
her.
yeah.
So imagine the happiness you bring to the whole family. Even the whole building will be
Exactly.
celebrating that she's pregnant.
Exactly,
Okay. So
yeah.
let us put hand in hand. Let us use the technology in our hand and our skills and our science to make more women more happy.
You know, I like you said that health is a crown seen by sick
By sick,
only.
yeah.
So whenever in the clinic somebody gets a good report, I always tell them, you should celebrate today because your report came normal. Because if it would have come abnormal, you would have told the world.
Yeah.
But since it has come normal, don't be silent.
Yes,
Today
tell
is
them.
a celebration
Yes.
day.
Celebrate with your.
Yeah.
Well, yes.
So you have helped millions of women, and I am sure that you would have incredible words of gratitude. I want to tell you some. I want you to tell us some story or some moment which stayed with you.
Yeah, definitely.
Yeah.
Every one of us has stories to tell.
Exactly.
Every one of us has stories.
Yeah.
And some of them, they leave a long-lasting impression, you know. So I always tell some of the stories to inspire others.
Yeah.
I remember I was invited once in a city in India called Indore.
Indore,
Dr.
yeah.
Brajbala Tuweri, they have a big center called Life Care Center. And to do training for doctors and some
Yeah.
surgeons. And during my visit, she said, Dr. Osama Shawki, we have one desperate case, has complete asherment. The uterus
Yeah.
is glued, totally
Yeah.
glued. And the image shows zero cavity.
Yeah.
And she has no menstruation. And she came traveling long distance, especially for your name and fame, and give her, please, help.
Yeah.
I told her, Dr. Brajwala, you know that these cases are hopeless.
Yeah.
Once the cavity destroyed, we don't have any chance to help them. She said, but the patient is crying and waiting. Do anything for her. To tell you honestly, I went to the patient to tell her, Madam, sorry, I cannot do anything.
Yeah.
Once I came, before I opened my mouth, she held my hand and said, Sir, I had a dream
Yeah.
that I will be blessed by a baby on your hand. I felt crushed.
Oh.
I felt crushed.
Yeah.
I couldn't say, okay, I will do hysteroscopy as a placebo.
Yeah.
You know, placebo means that you know
Yeah.
that it will not help, but just to
Satisfaction. She will feel
that we did
it may
our
work.
best, okay?
Yeah.
And the video of this case is on YouTube. When I entered the cavity, it was all glued, but it was like soft glue.
Yeah.
So when I increase the pressure of the fluid, it starts to open. And while I was operating, all the stuff as if in a cricket match. Wow, okay?
Yeah.
And then the whole cavity was open.
Wow,
But the lining was still white, atrophic.
Yeah.
All right? So after we created the cavity, I put a balloon, all right? Just to keep it distended. And I said, remove the balloon after 2 weeks, 1 week, and give her some hormones. And hopefully this will resume a normal cavity.
Amazing.
But still, deep inside, I was not optimistic, you know, because the cavity, the color of the endometrium was dead.
White, pale.
And then I left them, and 2 years later, I was visiting the same center to do another visit. See Dr. Brajwala tell me, Dr. Shawki, we have a surprise for you. You understand what
She
happened?
was pregnant?
She came carrying 2 babies, twin
my
babies.
God,
And I have the video for her, okay?
Wow.
I couldn't believe, is she the same patient?
Yeah.
She said, yes. We did IVF for her, and she has 2 babies. Many
Amazing.
stories like this inspire us
Yeah.
and give us power and energy and motivation to keep doing. Nothing is impossible. Never say hopeless.
Yeah.
Remove the less and
Yeah.
keep the hope.
Amazing. Now, women listening, and you want to give some direct message to them, I would really want to address them.
No, I don't want to say advice or message. I want to say for every woman on this planet, thank you. Thank you if you are a mother, a grandmother, a daughter, a sister. For every person in the world, you should know that women are the gift of God to us. We live by them, we live with them, we depend on them. If in a house there is a wife and husband and 2 children, and in the morning the husband is ill, stayed in bed, nothing will change in the house. Breakfast will be prepared, children will go to school, homework will be done, and everything in the house will be. But if we wake up and the mother is ill, it's a paralysis.
That's so amazing.
It's a paralysis.
Yeah.
It's always said that women represent 50% of the power of the society. This is true numerically.
Yeah.
But functionally, they take the responsibility of the other 50%. So thank you
Yes.
for every woman, make her family happy.
You spoke so soul of the she's well, so she should be well. Amazing. You spoke the soul of she's well, she should be well. I'm really happy, and so much information for my audience. So a little souvenir will go with you, which will.
Wow.
And I wrote
Wow.
Magician of Hysteroscopy
Oh, thank you.
specially.
Thank you. Thank
and
you.
there's a QR code. Anybody can just access to our podcast today.
Very smart.
And
That's,
no,
oh,
it's
wow.
an honor actually.
Technology, yes.
Yeah.
I am the one honored that you give me an opportunity through your channel with your whole audience to add some more information about their life. And I will thank you very much. And I'm going to
And
give
we'll do
this.
it again also.
Definitely.
Yeah.
I'm sure that all my followers will enjoy this broadcast. Thank you very much.
So we have a picture here.